So I am Dr. Sophie. I am a GP from Halifax, and I have an interest in women's health, but also in kind of really good, honest medical advice that you can trust. So in fact, I started a YouTube channel because I realised how difficult it is for anyone to kind of get through the sea of information that's online. I think at the moment it's not that we don't have enough information, it's just that we don't know which bit of it is true or false or how to. So I have, as well as my YouTube channel, I've done quite a lot of TV work and radio, because I, as well as helping patients on a one-to-one basis, I do really enjoy things like this, where I can spread kind of public awareness on a much wider basis. I think it's really important that if we have the knowledge, then we can be empowered to make kind of changes and live the life we want to live. So let's find out today what we can do. So the topic today is women's health, which often you think about as just kind of menopause and periods, but actually women's health is huge and covers all sorts of different topics that you might not necessarily think about. So there's gynecological and sexual health, and that includes like urinary incontinence, which is a big problem in women. It includes things like vaginitis, you might not know what that is, obviously yeast infections, vaginal infections, sexual dysfunction. Then you've got reproductive health. Obviously kind of we're thinking about things like contraception, but also fertility and infertility issues. Cardiovascular health. Now actually women have different signs and symptoms of a heart attack than men. So that's quite surprising, isn't it? And as doctors we need to be aware of that. And then we think about cognitive and brain health. Out of every 3 people struggling with Alzheimer's, 2 of them are women. And women are the main carers of people with dementia. So it does affect women more than men. And autoimmune conditions are very commonly, and most usually, women are affected by autoimmune conditions such as thyroid problems, such as lupus. And then oncology, so specific cancers. Obviously women can get lung cancer, bowel cancer, but also we can get things like ovarian cancer, endometrial cancer. And then aging and bone health, which we'll touch on a little bit today. So as well as osteoarthritis, women are at much greater risk of getting things like osteoporosis or thinning of the bones, which can lead to fractures. So women's health is a massive topic, and obviously I'm not going to go through all of that today. So today we're going to focus mostly on the menopause and perimenopause. If I have got time, we're going to talk a little bit about endometriosis, which we'll go into, but also how menopause and perimenopause affects us in the workplace and our mental health, as they are all interlinked. So this is interesting. This was a survey asked 100,000 people what were the top women's health areas that they think need more awareness. And obviously the list is long because there is a lot of topics that were just not really spoken about. And it's interesting when you think back, I mentioned about women's heart attacks being different. Studies and research from a medical education and information point of view have always looked at men. So only recently we started including women and seeing that actually women are not just men with boobs. we are different beings. So things like gynecological conditions such as fibroids and endometriosis. Who knows much about that? Probably not many people at all. And then you've got your conditions such as the menopause and perimenopause, fertility issues, menstrual health, things like adenomyosis. Has anyone heard of that? By the way, there's things in here that I might mention and not cover. If you have a look at my YouTube channel, I may have a video giving you more information if you want to have a look. So lots of topics. What we need to do is make sure we increase awareness of these common women's health problems. And of course, women's health changes as we age and grow. So when we're thinking about young adults, we're thinking about puberty, thinking about HPV vaccination. That's what schoolgirls get to try and prevent them getting cervical cancer, which is amazing actually. Thinking about sexual health problems, fertility or contraception, and pregnancy issues. And then middle years, we're thinking about the perimenopause. We're thinking about cervical screening, we're thinking about gynecological cancers and pelvic floor health, which is also really important and not discussed enough. And then in our older years, we're thinking about menopause, postmenopause, osteoporosis, because actually 50% of women over 50 will have osteoporosis. And do those women may not even know it? Do they know how to manage it? Do they know how to prevent it? Probably not. We need to discuss it more. And older years, obviously, as you age, you have an increased risk of cancer and dementia. So what is menopause? Sounds like an easy question, but actually, if you ask people just what is menopause, do you actually know the answer? So it's just a normal part of women's life cycle. So in the same way that we all go through puberty, as long as we live long enough and we're a woman, we will go through the menopause. And when I say woman, this is anyone I'm talking about who was assigned female at birth. Obviously it can affect trans people as well. So what happens is we lose estrogen. So our estrogen is reduced because our ovaries are no longer producing an egg once a month. So typically this affects women's periods. So the perimenopause is is the time when you start having symptoms related to this reduction in estrogen. And then the menopause is just one day. It's actually just 12 months since you last had a period. And once you've had that day, then you are postmenopausal. And the most common age is between 45 and 55 for the menopause. So on average, it's 51. But as we'll see on the next slide, the perimenopause can actually affect women much earlier. So it can affect women in their 30s. Commonly, it starts between kind of early 40s. I have lots of people come and see me as a GP, tell me about some symptoms, and I say, have you considered it could be menopausal? They say, no, I'm only 43 or 44 or something. And they think they're too young, but actually, you're not too young, especially because some women can suffer perimenopausal symptoms for a decade before their menopause. So most menopause symptoms last around 5 to 7 years, but that statistic I think is probably not true. I think people are just not being very open and honest about it. From my experience as a GP, symptoms can last a lot longer. Around 1 in 100 women experience menopause before the age of 40. So we call this premature ovarian failure, and this can be a big impact on women's fertility. Now, if we think about it, if the average age of menopause is 51 and the life expectancy is currently 82, but it's growing higher, depends where you live in the country, so at least 30% of our lives are going to be spent postmenopausal. So when you think about it that way, do we know enough about how it affects our body, what the risks are, what we can do about it? Probably not. And there are over 30 recognised symptoms of the menopause, including cognitive changes, so affecting your brain, physical and psychological changes, which I will go into in a minute. And 80% of women suffer from menopause symptoms, of which 25% suffer with really severe symptoms. So I think it's just worth acknowledging that this can be really debilitating. So it often can be kind of brushed off as just, well, everyone has to manage it. I just got on with it. You know, you might hear an older woman say it. Because I think that's women have often been told about women's health problems, and especially the menopause, kind of just to put up and shut up and just get on with it. And actually, we don't need to do that anymore. We can do more than just get on with it. We can get help. So why is estrogen important? Well, estrogen affects every cell in your body. So it affects your brain. It regulates your temperature control, helps with your memory and your libido. It affects your heart. So your heart rate, it helps make sure the blood vessels have a healthy lining. It helps lower your cholesterol with help from the liver. It keeps your bones nice and strong. And it's good for your skin. So it helps the collagen production and reduce moisture loss. So that kind of youthful, plump, nice looking skin. And it helps your joints and muscles. It's anti-inflammatory. It helps lubricate the muscles and the joints. It helps with joint strength. And even the bowels. People don't think about that. But estrogen helps maintain the function of your bowels and helps with the gut microbiome. And it even affects the nerves, the nerve transmission, and finally the bladder. So it reduces risk of infection and controls bladder function. So when you think and put into perspective all the reasons why estrogen is so important, then you can start to understand why when we start to lose estrogen in the menopause, we get the symptoms. So let's have a look at that. So symptoms of menopause are massively varied. 75% of women didn't even realise that their symptoms were related to the menopause, and half of women don't even go and see their GP about it. And that's because they're not aware. So people think hot sweats and their periods changing. A lot of women, that's kind of all they're really aware of. One that's not on this list that I think is one of the most commonly complained about from women who come see me is that they sleep. Really struggling to sleep. It may be because of the hot flashes, which 75% of women get, but there's all sorts of other reasons why. And once you're tired, everything else is hard. So you get brain fog, you can get increase or new headaches and migraines, you get sore breasts, you get vaginal dryness, and women are often really embarrassed to talk about this. And I'm not embarrassed as a GP, I say, have you got any vaginal dryness? If you're having any pain on sex, if you're sexually active, this is important. And actually, talking about sex, have you got a reduced libido? And people think this isn't necessarily a thing you're going to speak to your GP about, but it is. And it's actually often really important, and it's something that's important in a relationship, so we can talk about it. Mood swings, so this is a big one. Often women will say things like, I am so irritable, I want to just snap at everyone. And I'm also much more anxious. I didn't used to be this anxious, and I'm finding myself really worrying about things. And that's often down to the menopause. but it also can affect your eyes, it can affect your hearing, and you can get tinnitus and vertigo, something called burning mouth syndrome. You can get heart palpitations, shortness of breath, frequency of urine infections, even changes in your body odour. A lot of people talk about itchy skin, dry itchy skin, and you can even get tingling extremities. So, massively varied symptoms. And I think out of anything, this is one of the most important slides, because I think this is what a lot of men and women have no idea about. And that's why I think it's important that we think about menopause education is for everyone, because you might not be menopausal watching this, but you probably know someone who is. And either you can help them be aware of all these symptoms, or even if it's a colleague or a boss, then you can start to appreciate just what they're going through and what's happening. So the influence of estrogen. So it does change over time. So when we are young and premenopausal, we have a nice steady, regular amount of estrogen in every cell doing all those nice jobs. As you become perimenopausal, it starts to drop, but it doesn't just drop gradually, it spikes up and down. And this is why, if you're over 45, we don't bother doing any blood tests, because we might catch you on a good day or we might catch you on a bad day. So it's just up and down. And then once you are menopausal, it just drops, and then it's a steady low amount, because you can get estrogen. The body does make estrogen outside of the ovaries, but in a much smaller amount. Okay, so then what about physical health? So we've gone through all the kind of annoying symptoms, but actually menopause itself can affect your physical health. So bone loss and osteoporosis is a big one, and estrogen has a big impact on this, so much so that it's one of the first line treatments for women under 65 who have osteoporosis is to think about HRT and cardiovascular disease. So actually, men have a higher risk of heart disease than women up until the menopause. And then it starts to even out. And by the time we're 70, men and women have the same risks of heart attack. So obviously it sounds like it's linked with the menopause. And obesity. Now I do see this a lot as well. Lots of patients come in really struggling with putting on weight, often around the middle. We don't quite know why it is. It's probably lots of different reasons for it. And then with that weight, especially around the middle, that is what increases your risk of things such as type 2 diabetes. So there is risks to the physical health beyond the kind of annoying symptoms. And mental health. So I've mentioned how women can say they're kind of feeling more anxious, but even can get panic attacks. And then depression and low mood, so much so that I see lots and lots of women who have been started on antidepressants because they've been struggling with their depression and low mood. But when you ask them when did it start, it oftentimes with the kind of perimenopause. And what we know is if you treat depression that's linked to the menopause with antidepressants, it doesn't help. And antidepressants have got lots of nasty side effects, so if you don't need to be on them, then all the better. So it's good just to be aware, is that depression and low mood related to the menopause, or is it something else? And low self-esteem. I think when you've got all those symptoms we've described, that when I kind of say them all in a big list, it does sound pretty miserable, doesn't it? You've kind of got your dry skin, you're putting on weight, you've lost your skin turgor. You know, women often look in the mirror and think, I don't even recognise myself anymore. Look, who's this old woman looking back at me? And I put weight on and I don't want to have sex with my partner anymore. So low self-esteem is a problem. And then memory loss and brain fog. So kind of forgetting where you put things, forgetting what someone's told you can get worse. So how do we diagnose it? Well, the first thing I'd suggest is to be aware of what the symptoms are, and then try and keep a little diary of what these symptoms may be. There is something called the Green Climacteric Scale, which is a little questionnaire you can fill in, and that's really useful if you can take that with you when you go and see the GP, as well as the dates of your periods if you're still having them. We will discuss that with you and think about whether or not it could be the menopause. If you're under 45, sometimes we will do the hormone test to tell us if you are menopausal. But if that still comes back normal, but you've still got symptoms, it may still be worth trialling treatment if you want it. If you're over 45, as I said, there's no point doing the blood tests. We may also want to do some tests to make sure there's nothing else going on causing your symptoms, because obviously it could be that you've got anemia, or it could be that your thyroid gland isn't working properly. So we just need to make sure we're not assuming it's the menopause when there's something else going on. And we may suggest HRT, which I'll come to talk about shortly. Okay, so how does this all affect women in the workplace? Does it matter? Can they just crack on with it? How does it affect the individual, and what can the team members do about it? So, some stats for you. So, menopausal women are the fastest growing demographic in the workforce. Come on, menopausal women. So, there are currently 4.5 million women aged 50 to 64 in employment, So almost 8 out of 10 menopausal women are in work. However, are they happy? 47% of them who needed to take a day off admitted they wouldn't tell their employer the real reason. I think this is such an interesting fact because I think it shows that there is still a huge stigma to being open and honest about symptoms that women are struggling with the menopause. Possibly, especially if they've maybe got a male boss, they might feel really awkward talking about it, and that's what we need to change. 45% of women say they feel their menopause symptoms have had a negative impact on their work. In fact, 1 in 10 women leave their job completely, which is pretty astounding. And that equates to 333,000 women aged between 45 to 55 in the workplace leaving their jobs just because of the menopause, which is a completely natural thing that we're all going to go through. So this sounds bonkers, doesn't it? We need to do something about it. A further 13% of menopausal women who have been employed during the menopause have considered leaving, and 14% have reduced their hours. It means that women are cutting back their hours. Studies show they're also forgoing promotions. They're kind of thinking, oh, I'm not quite up for it, I haven't got my mojo, I'm feeling a bit tired, I'm not sleeping well, blah, blah, blah. They're taking sick days and they're leaving work. And studies also show that these women are in their peak of their career. They have got the knowledge and experience, and if we just give them the chance, they're going to be shining stars in the company. They're going to be role models to their younger peers. So by ignoring these menopausal problems and hoping they're just going to go away, we're obviously having a negative impact on the person themselves, on the team members who are left without that role model, and on the business, which is taking financial hits on the days off, on recruiting a new person, which is going to cost a lot more money, and even the UK economy. So from even just beyond that, how that person is affected, we all need to be aware of how menopause affects businesses. So what can we do? This is very important, isn't it? I told you all the miserable symptoms. Well, I think by doing this, first of all, understanding it. And I would like to think that people, even who aren't affected by menopause, perhaps as yet, or perhaps are men, or, need to get on board with understanding it. And being able to discuss it, breaking down the stigma, encouraging open conversations about this, because that's how we can find out how to get to solutions. And then once we know about the problems and we've discussed the problems, we can then look at making reasonable adjustments and how we can use company resources to try and improve things. So what kind of adjustments can you make? Well, some of these sound super simple and straightforward, but I would ask yourself, are these things happening in my office at the moment? Maybe not. So for hot flushes, obviously try and cool down the environment. So maybe that means moving the desk nearer to the window, or using an aircon, or even just a desk fan. Making sure you've got access to cold drinking water. What about brain fog? That's a bit harder to tackle, but encourage colleagues to discuss their concerns and then see if there's any triggers, what's making this worse. Try and figure out together what can we do to solve these problems or make them easier. What about sleep disruption? Can they have some short-term absence if they've had a difficult night? Can we change their shifts? Can we make flexible working arrangements or work from home? And headaches and fatigue. Again, maybe this is a change to the work duties, but even just providing a quiet area to work. Often office spaces are kind of very noisy with kind of bright, kind of fake lights from above, which if you're a migraine sufferer is like the worst thing. So perhaps you can provide a little quiet space where they can go to continue working. But also just regular breaks, and again, working from home if that's at all possible. Okay, and then when we're thinking about adjustments for mental health, obviously this isn't just about menopause. Mental health is a problem that affects anyone of any age. So first things first is encouraging colleagues to discuss the problems. Have a one-to-one meeting with a line manager or the occupational health nurse. Don't try and soldier on in silence. Obviously, you can also come and see your GP, but we would always encourage you to go to also speak to your occupational health team. Number 2 is discuss possible adjustments to the tasks and the duties that are providing you a challenge. So what is it you're finding difficult? What can we do about it? 3, you can signpost to the employee assistance programme, HR, or mental health support. And 4, identify a supportive colleague to talk to away from the office. Plenty of places have now kind of menopause champions, mental health champions. Do you have one? Do you know who it is? If not, could it be you? Maybe this is your opportunity. And allow time for employees to have some quiet time to relax. In our modern life of 24/7, we're always go, 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 go. But from a productivity and health point of view, having some regular breaks is good for the well-being of that person, for the team, and actually you end up being more productive. So yeah, providing a quiet space to work or the opportunity to work from home may be helpful for anyone struggling with their mental health as well. So I think women's health advocates, in recent years, we've been hearing a lot more about women's health. And I think a lot of that is down to celebrities speaking out, actually, and saying, yeah, this isn't okay. We kind of want to make sure more people know about this. So Davina McCall has obviously done a lot about raising awareness of menopause and HRT. She made sure GPs like me were very busy with patients coming in after the documentary wanting HRT, which is good. Carol Vorderman opened up about experiencing depression during menopause, and I think this is really important because again, what we see on social media, you know, people want to put up pictures of them looking gorgeous and really happy, and we see celebrities on TV who are, you know, Carol Vorderman, you think, oh, she's even older than me, but look at her, she looks so happy and beautiful and wonderful, and here I am with my dry skin and I put on weight, and so it's actually really nice to know that everybody's normal and everyone has the same struggles. Even someone who looks gorgeous and wonderful like Carol Vorderman also is struggling. So I think that helps people feel like there's nothing wrong with them, they're just normal and everyone has these similar problems. Emma Bunton was diagnosed with endometriosis, age 25. Again, we're going to hopefully talk about that if we've got time at the end. Molly May from Love Island, she was also diagnosed with endometriosis because of the severe pain she was having when she was on her periods. So it's great that people are talking about their women's health problems. Carol Vorderman quoted as saying, even when I was hosting Loose Women, which was 10 years ago, it was only acceptable to say, oh, I'm having a bit of a moment, and make light of it. Now, thank God, women are going, nope, stuff that. This is what's happening. I need help in the workplace. I need to be able to hear from people who are doing this. And I think, yes, Carol, I'm with you. Let's shout out that you need help and we should be honest and open about it instead of having to put up and shut up. Next quote from Michelle Obama. I thought it was very interesting. There is not a lot of conversation about menopause. I'm going through it, and I know all my friends are going through it. All the information is sparse. And I think, goodness me, if the president's wife doesn't think she's got enough information about the menopause, which is something that affects 51% of the global population, then how is the average Joe going to think they've got enough information? So that's what we're all trying to change. Medics like me trying to get the right information out there. Okay, so if you did come to the GP or your occupational health nurse, the first thing we would talk about is self-care. Now, often, women at this age group, when I talk to them about, give me a bit of information, what's going on, who do you live with, what do you do? Often what's happening is they're struggling with perhaps older parents who are maybe becoming unwell. They might have teenagers or young adults who have got their own strife and struggles. They're obviously dealing with work stress, and they may also have relationship problems. It all seems to often kind of combine at this time. And what women aren't very good at is looking after themselves. So often they'll be kind of making sure everyone else is okay, doing lots of caring for everyone else. I haven't got time because I'm doing X, Y, and Z. And I say, this is a bit like on an airplane. When the oxygen masks come down, you have to put the oxygen mask on yourself first before you can help anyone else. So this is the time you need to put yourself on the top of the priority list and start looking after yourself. Because if you don't, you won't be able to help all those people anyway. So first things first, plenty of sleep. People really underestimate how important sleep is, even for kind of like for weight. It's very difficult to lose weight if you're not sleeping well. And I know you're probably thinking, oh, that's easy for you to say. I'm trying, but I'm struggling. Well, I think there's lots of things to try, but just make sure you're making it a priority so that you can focus on how to improve it. And relaxing. So think about ways you can relax. Maybe you enjoy yoga, meditation, or it could even just be going for a little walk at lunchtime, trying to get out in the fresh air, meeting friends for coffee, anything that you can, you spend time enjoying and relaxing. On a healthy diet. Nobody ever really wants to hear about how important it is to have a healthy diet, but this is the time in your life where it really is important because we know this is the time you've increased risk of the diabetes and the heart disease and your bone health, so you do need to focus on that now. As well as making sure you've got enough vitamin D and calcium in your diet. If you don't and you're not getting outside enough, then you may well need to supplement to protect your bones. And regular exercise. This is so important when you're menopausal. You need to do make sure you're getting enough exercise. That also helps your bones, and you need to help keep your heart healthy. And it doesn't have to mean that you're going to the gym 3 times a week. It can be, but find something you enjoy. Think about moving your body rather than exercise if that kind of scares you, if you're not a kind of gym bunny. Find something you enjoy doing. As long as you're getting a bit of a sweat on and you're doing it regularly, then that's going to be great. And if you can find something that's got a group activity, especially if it's outdoors, then you're going to be ticking to make sure you're looking after your mental well-being as well. Reduce alcohol and stop smoking. That should be on there. So I'm sorry if you're smoking, this is the time, you've got to stop. You're really not doing yourself any favours. And reduce alcohol. I know we live in a kind of society where for a lot of people smoking is drinking alcohol is kind of part and parcel of socialisation and getting home and relaxing. And I'm not saying don't drink any alcohol, but a lot of us are probably drinking too much, and it affects your sleep, and it affects your weight, and it affects your palpitations and your hot flushes. So try and think about how much you're drinking and see if you can cut down if you think you're drinking too much, which is 14 units a week is the guidelines. And then think about keeping cool. So try and think about the clothes you're wearing. Loose cotton clothing is kind of ideal. So if anyone's got kind of a uniform or something they wear that's a bit tight and made of like polyester, then that's not going to do you any favours. Okay, so lifestyle things first. But then some people may want to opt for some HRT, which is hormone replacement therapy. A lot of people are a bit scared about HRT, but we've come around to it recently, realising it's not as dangerous as we thought. So I'm a big fan of it, actually. So what it does is it replaces a lot of the hormones you've lost. So we top up your estrogen levels, and then we give progesterone to protect your womb, if you still have a womb. And what this does is it improves all those symptoms we mentioned. And it's a first-line treatment and prevention for osteoporosis in women under 60. Helps lower your incidence of cardiovascular disease, so heart disease, in women starting within 10 years of the menopause. So actually, you're better off starting sooner rather than later if you're thinking about it. You don't have to wait until you're absolutely desperate, not getting any sleep, covered in sweat and struggling with your mental well-being. As soon as you think you've got perimenopausal symptoms, if you want to consider HRT, then get booked in with your GP sooner rather than later. And actually, it can improve your skin turgor, your collagen, and the skin thickness. I mean, how many of you are out there spending a lot of money on collagen supplements? If you're not having HRT, it might not work as well. And HRT can actually potentially reduce the risk of type 2 diabetes, dementia, obesity, depression, and even bowel cancer. So overall, it reduces your mortality risk, so your risk of even dying. So for most women, the benefits outweigh the risks, but it isn't for everyone. So do speak to your GP or healthcare provider to find out if it's right for you. Okay, so I'll just quickly try and talk about endometriosis. So this is really not very well known about. It's where you get tissue that's similar to the lining of the womb growing outside of the womb. So it often covers the ovaries and the fallopian tubes and the bowel actually as well. So every time you have a period, it bleeds in these areas, causing pain, causing inflammation. And over time, this then becomes very sticky and causes adhesion. So, for example, parts of the fallopian tubes can stick together, or the bowel can stick together, which is why then it's also related to fertility issues. But because it kind of has got such a vague symptoms, and the only definitive way to diagnose it is through keyhole or laparoscopy, that it takes an average of 8 years for women to be diagnosed. So isn't that bad? And actually, over those 8 years, their symptoms are getting worse and going to have more long-term effects. So something that even I'm keen to kind of push even more medics get aware of to try and help these women. Because what this endometriosis can do is have a really vast impact on their life, including chronic pain. Because at first the pain is just cyclical whilst they're having their period, but once you've got the inflammation and these adhesions, the pain can be all the time. They can get fatigue, lack of energy, depression, feel isolated. They can get problems with their sex life because they have painful sex. They have an inability to conceive. It's one of the main causes of fertility problems. And therefore, because of all this, they just can't really manage their work and social commitments. From a financial point of view, it costs the UK economy £8.2 billion a year. That's in kind of missed work and also in investigative costs, in treatment. And 81% of women said that endometriosis has impacted their mental health negatively or very negatively. It's just important to remember that endometriosis is not an infection, it's not contagious, you can't catch it, and it's not cancer. Just to finish off, there are some good support agencies to get more information and help if you need it. The Menopause Charity or menopausesupport.co.uk, Endometriosis UK, and fertilitynetwork.org. As I said, I've got some YouTube videos as well on some of these topics if you want to have a look and find out a bit more information. Okay, we're on to Q&A.
We've had a question saying, what do you do if all forms of HRT you were able to take makes you worse?
Well, I would say often we have to give 3 months to test a kind of HRT. So women do find that they may struggle with symptoms initially when they're on HRT. Often that passes. So maybe women might feel a bit worse for the first few weeks of taking it, often I'll say, oh, can we lower the dose? Are you on the low enough dose? And have you tried it for long enough? Shall we try a different form? I haven't come across many women who really can't take any form of HRT, even if they've given it enough time. So usually it's about the dosage or giving it enough time. Or there's something else going on. Again, HRT isn't a panacea that's going to fix everything. So if you actually are struggling with depression, perhaps you actually have got other health conditions. So it might be worthwhile going back and checking what else is going on.
Great. I'm 44 and on the mini pill. I have perimenopause symptoms. How do I know when I can stop taking the pill for contraception and to stop periods?
Yeah, it's a common question because most women don't have periods when they're on the mini pill. Well, one thing, you could stop the mini pill and have a C if you get your periods back. If you don't want to do that, you could just opt straight to change it to a Mirena, is often what I suggest, a Mirena coil, because the Mirena coil covers you for contraception and HRT. So when you have HRT, you need the estrogen for the symptoms, but you also need progesterone to protect your womb. And Mirena is one of the safest ways to have that progesterone to protect your womb. So if you're perimenopausal, it's a good idea really to switch to the Mirena if you're happy to have the coil, which often women also won't bleed on, and then it can stay in for 5 years for HRT.
And on the point that you're making about the estrogen and about how that obviously decreases, you can get pills that are estrogen only, can't you? So do they help if you're on that sort of pill when you start perimenopause or when estrogen levels start to dip? Is there a correlation in that?
Do you mean contraceptive pills?
Yeah.
Yeah, you can't get estrogen only contraceptive pills. You can get combined estrogen and progesterone, or the mini pill, which is progesterone only.
Right.
So yeah, if you are perimenopausal, sometimes the combined pill can help.
Okay.
But for a lot of women, they can't take that combined pill. As you get older, your risks increase of things like blood clots.
Right.
So if you're carrying a bit of extra weight, or you're over 35 and you're a smoker, there's things like that make it less of an option. But yeah, it can help some women.
We've got lots of questions coming in now. This is great. Is it true that the age you start your menopause can follow the pattern of your menopause?
Yeah. A lot of women do find that. So if their mum started their menopause early, often they might as well. So can often do, yeah.
So it's worth speaking to your mum and seeing
Speak to
what
your mum,
her
ask her.
journey was.
Yeah.
Right. Do you need to take HRT or will supplements be enough? I don't have many symptoms like flushes, etc.
So alternatives to HRT do include supplements, and some women do take things like black cohosh and whatnot. There's no really good evidence for supplements at all, and with any supplement you buy is unregulated and you don't really know what's in that pill. So I'm not a huge fan, as you could probably tell. But if someone's taking supplements and they're happy with it, then that's absolutely fine. So you don't need to take HRT. Many women go through the menopause, don't suffer with any symptoms, and are very happy not to take HRT. So it's just as long as you're aware of all the other symptoms beyond hot flushes. Because often what women come and say, I'm not really struggling with hot flushes, but I have got all these other things. And I'll say, oh, did you know that could be the menopause and you may still benefit. You can always trial HRT if you're unsure for 3 months, see how you feel. If you don't feel any different, stop it.
Okay. When do I have to stop taking HRT?
Never. You don't have to. So we would certainly suggest you have a review once a year and try and lower your HRT.
So once you start taking it, you continue to take it?
Well, most women don't take it forever because we used to be very scared about HRT and the risks of breast cancer. So it does depend on each woman, and you kind of have to review your own risks. But if you are finding benefit from the HRT, there is no time or age you need to stop. A lot of women certainly will continue with vaginal estrogen, which is HRT, but it doesn't carry the same risks. So I think more and more that pretty much every woman should have vaginal estrogen as you get older forever, because your estrogen is never coming back, and that kind of vaginal dryness, increased risk of urinary infections, inability to have sex, those things are all also prolapse, incontinence, those things are all worsened.
And is that a tablet? Because I've never even heard of that before.
You can get it in, most commonly it's a pessary, usually twice a week, or you can get ring. There's all sorts of different things.
Wow. So there's so many treatments. It's like a rainbow, isn't it?
So you don't have to sit there in silence and try and manage it. That's the thing, I think.
Yeah. It says, why is there a reluctance to test for testosterone levels as this affects mood?
So unless you got a menopause specialist at your GP practice, they may not be confident with managing testosterone, and they may suggest you have to go to a menopause specialist. I do prescribe testosterone for my patients, so I'm not reluctant, but it is only licensed for lack of libido when all other avenues have been ruled out, and only for women who are already on HRT and are adequately estrogenized. So if they've not got any hot flushes, symptoms like that, and the only symptom they really got left is low libido, then we can trial testosterone. We do have to do some blood tests first, and we do have to monitor it. And yeah, so you might find a doctor who can do that, or sometimes you have to pay privately.
Okay. I've been told that some women are struggling with getting hold of HRT as there is a shortage. Is this true?
It was, but it seems to be okay now. I've not had any bouncing back to me in recent weeks.
Also, not sure if everyone on the call knows you can get a HRT certificate and only pay one-off prescription cost. I know this is only for certain HRT though. I'm on HRT and it's great. That's good.
Good point, good thing to mention. That's quite a new thing that's changed. I think, was it Tina McCall who was, Louise Newson, I think, was helping get that through Parliament. So yes, so you just pay a one-off prescription cost now, and you can get your HRT within that cost for every year. Make sure that you don't have anything else. So for example, if you get an inhaler added on the prescription, then you end up having to pay for it. So it has to be a separate prescription just for HRT.
Great. So if you could give any advice to people who are on this call that have perimenopause or menopause symptoms, what would you tell them to do next? What would be their next steps if obviously they're at the beginning of their journey?
To try and make those lifestyle changes. So have a look at what you can do, first of all, to improve your own health.
Okay.
Because that is the most important thing that will affect every symptom and every risk factor. So for example, if you're not doing enough exercise, if you're carrying too much weight, if you know you're not eating healthily, drinking, smoking, all those things, that's the first thing you should change.
And they have a big impact.
Yep. Yeah.
Right. Okay. That's good to know. I've been diagnosed with vaginal atrophy.
HV, yeah.
HV. I'm on Clyofen. These are words I've never seen before, and have been given estradiol as an add-on since diagnosis. Is there anything else I can use to help with itching and soreness?
You can buy vaginal moisturisers from the pharmacy that can help keep the vagina moist and dry. Stop it being dry. By the way, Clyofen we haven't touched upon this, but is one of the oral estrogen HRT. So typically nowadays we recommend women have what's called transdermal HRT. So the progesterone, if you have a womb still, if you've not had a hysterectomy, the safest is either the Mirena coil or a tablet you take at night called Utrogestan. And that's body identical, and it's got we know that in terms of breast cancer, it's got the lowest risk. And then you only need the estrogen, and the safest way to have the estrogen is via a patch, a gel, or a spray. So if you're taking the estrogen tablet, I would go and think again, because estrogen tablet comes with an increased risk of what we call VTE, so that's like strokes and blood clots. So especially if you've got any risk factors, especially if you suffer with migraines, but for anyone really, I don't. Unless there's a particular reason why you really want the estrogen tablet, switch it to the transdermal route, which is much safer.
Right, okay, that's good to know. With the HRT, are the same benefits seen on different ethnicity?
Yeah, I don't think, I'm not aware of any changes of ethnicity for HRT. Different people have different doses, so not everyone has the same amount. So we start, for example, if we go from patch on a 25 patch, then it goes to 50, 75 and 100. So younger women often need higher doses, and then as you get older, usually you can reduce it.
Okay, great. How do you know when you hit menopause when you have the HRT pill, which creates a bleed each month? I have the patch as well.
So usually you either have a continuous regime or not. So women who are perimenopausal, who haven't had a bleed, who are still bleeding, or have had it in the last 12 months, we usually suggest that they, for example, if you take a Utrogestan, then you take that for 2 weeks out of 4, and you'll often have a little bleed when you stop taking the Utrogestan. Once you are postmenopausal, then we suggest you take the Utrogestan pill once a night, and then you don't tend to have any bleeding. It's not necessarily rhyme or reason, it's just because if you're still having periods and we give you the tablet to take every night, you can have irregular bleeding, which can be annoying. So it's up to you. If you're not having any bleeding and you're having the break, then you can try and switch to the continuous and see how you get on.
Great. A question literally just come in. What's your opinion on the Dutch test versus blood testing on hormone levels? At what stage or stages of the cycle should hormone testing take place?
I try and be really delicate, I don't know. Yeah, just do not waste your money on the Dutch test. And any provider who is suggesting that, I would suggest you look elsewhere. It's not validated or regulated, and often, providers who are suggesting the Dutch test usually then suggest you only have progesterone. Yeah. So find a menopause specialist who is, if you're going to seek privately on the website. I'm trying to think what the website's name is, but there's a menopause, regulated menopause specialist.
What is the Dutch test? I've never heard of that.
So it's a urine test. They say, oh, we look at all your hormone levels and we will balance out all your hormones and blah blah blah.
But it's not certified or anything, so
I think it's just a test to see how willing you are to give your wallet.
right.
I didn't stay as nice as I should have done.
Fabulous. Okay, just had a really nice comment, not a question, just a comment. Found this really useful. I've had breast cancer, so I've been put in a medical menopause via ovarian suppression. Unable to take HRT, so looking into alternatives. Working on lifestyle and being cold water swimming since Feb. Enjoying it so far.
Yeah, loads of menopausal women really enjoy cold water swimming and get a lot of benefit from it. I enjoy cold water swimming actually as well. And there's groups of women who do it. Make sure you do it in a group, make sure you're safe when you're doing it. But yeah, that's fantastic. Unfortunately, some women can't have HRT. So looking at alternatives, and there are other alternatives. There's difficult evidence in terms of how much they're helpful. So looking at your lifestyle and things like that is really fantastic.
Lovely, great. Well, I think we're going to wrap up now. Thank you everyone for watching. I hope it's been insightful for you. We've really enjoyed it. Thank you so much for coming
You're
down
welcome.
and joining us. Please do follow both Latus Group and Sophie on Instagram, on LinkedIn and on our socials. As Sophie said earlier, she's got a YouTube which she posts lots of videos on, and there's lots of content going on there all the time. So if you're interested in this and other areas of women's health, then definitely give her a follow on there. But thank you so much everyone, really appreciate you for joining, and you'll probably hear from me over the next couple of days just as just to say thank you and to check in with you all. But hopefully we'll see you again on some of our future webinars as well.
Thanks for watching.
Thank you.